My dental health promotion is based on the use of sealants to prevent the caries caused by many microorganisms in the oral cavity, seal out the tooth, and prevent decay. My name is Danai. I use the Healthy People 2020 to find my study and implement my program. Uh, I use the OH 2.2 that says reduce the proportion of children aged 6 to 9 years with untreated dental decay in their primary and permanent teeth. I found the target population, the basal information, and all the sources to implement my program. Tooth decay is one of the most common chronic conditions of childhood in the United States. Untreated tooth decay can cause pain and infection that may lead to problems with hearing, speaking, playing, and learning. Caries prevalence is still high in children, and susceptibility of molar is much greater than other teeth. About 1 of 5 children aged 5 to 11 have at least one untreated decayed tooth. Healthy People 2020 has identified dental caries in children as a concern to work on it and the use of sealants to prevent childhood caries. OH 2.2 reduce the proportion of children aged 6 to 9 years with untreated dental decay in their primary and permanent teeth. 28.8% of children aged 6 to 9 years had untreated dental decay in at least one primary or permanent tooth between 1999 and 2004. The target population for this study was 25.9% of children aged 6 to 9 years that had untreated dental decay. I used two articles to implement my program to find all my studies and have the enough information to present to my target population. The first article that I use is Pulp and Plaque Microbiota of Children with Severe Early Childhood Caries. And the second one is Monitoring of Sounds and Caries Surfaces under Sealants over 44 months. The first study that I found has good information about severe early childhood caries, which is a devastating dental infection that affect children with oral health disparity. The microbiota of ECC is complex and include acidogenic and acid-tolerant species. Gram-negative species are detected in deep dentinal caries and in pulp and the root canal infection of primary teeth. Children 2 to 6 years old with severe ECC had extensive caries in the primary dentition, had a full mouth dental rehabilitation treatment under anesthesia, and the caries and the gingival status were shared, and biofilm from caries lesion were taken using toothpick. And then bacterial samples from caries biofilm were processed using microbiological method. In the second study, children 7 to 10 years old were monitored for detection of caries lesion through a clear sealant over 44 months. 77 children met the inclusion criteria, which had at least two fully erupted permanent molar without occlusal restoration, sealants, or cavitary lesion, were generally healthy, were available for all visits, and they provide written consent. This study evaluated detection and monitoring of caries lesion through a clear sealant over 44 months. This program proposes sealants program to prevent childhood caries. We are going to implement the plan in multiple steps. First, giving the awareness to the children, teachers, and parents by detecting biofilm formation and explaining the disease process. Second, the assessment of the plan by caries detection. Third is the dental education by explaining the caries prevention, the brushing technique, flossing as a home care, and the use of sealants to prevent the dental caries in children at risk of higher level of microorganisms in caries exposure. Then we evaluate the condition, we identify the problem, develop the plan, implement the plan, and then evaluate the final outcome after a period of time. The primary environment to work in the program is the BPK school and elementary school because the target population is attending those schools. However, I would like to implement the program especially in children attending ESOL classes since their first language is not English. Our goal is to improve the oral hygiene of children and their parents' education and help them with the learning process for a better oral condition. Help young help young children to prevent caries and tooth loss early in life is another goal. And we have some pros to implement this program, which are good follow-up program with children, good contact and communication with their parents and the willingness of their teacher. And we also found some cons, which are the schedule conflict between hygiene students, children, teachers, and parents, the disinterest of parents' collaboration, and the lack of motivation from children. Our program work for our hygiene school, teacher school, and nursing school, but the primary professionals who implement this program are hygiene students, dental hygienists, and dentists. To implement this program in school, we need many resources and funding willing to help to improve the oral health of children by the use of sealants. So, some possible resources and funding are Dental Service Corporation, Government Fund Program, Health Department, American Dental Association, local health agency, and also fundraising through Dental Hygiene School Help, and federal grant writing for dental services in children is another funding. The objective of this initiative is to prevent the untreated caries and to improve the oral hygiene in children. We are going to use two methods, which are the statistical and the microbiological method. The outcome goals in 24 months decrease the amount of cavity and improve the overall teeth health. In this graph, I want to show you that patients with sealants will decrease almost 100% cavities, and patients without sealants can increase the amount of caries in the primary and permanent teeth. To measure this program, we use the DMFT for incidence of caries, which have the status of dental caries activity or decay, use all primary and permanent teeth and all surfaces of the teeth, and also we use plaque control record using all primary and permanent teeth, record presence of bacteria in all surfaces, and count and record number of surfaces with retained plaque. The time frame for this program is in 24 months, starting with the new assessment, reassessment for decay detection at 12 months, and reassessment for decay detection at 24 months. This research will involve the quantitative study design. Data will be collected to evaluate children aged 6 to 9 years with untreated dental decay and sealants treatment attending elementary and BPK school. Descriptive analysis will involve the collecting data of age, gender, ethnicity, income, and school attending. Inferential analysis will score at each exam period an agreement between a score before and after sealants. The data analysis will involve statistical testing by descriptive analysis and comparative analysis. Descriptive analysis uses the measure of central tendency by using mean, median, and mode, and the frequency distribution by using number of times each score occurred in the group. Comparative analysis comparing two assessment time frame using the test, t-test. Data will be displayed using descriptive analysis of microbiota in exposed bulbs and the present in caries using cluster bar graph. Also, prevalence of dental sealants in permanent teeth by age and race using histogram. And comparative analysis through Diamondent score, pre and post sealant by Baseline ICDAS and S-rays score using tables. Statistical decision making will involve hypothesis testing. Null hypothesis will show no changes in microbiotas in caries without sealants use. Alternative hypothesis will identify changes in caries amount after the use of sealants. Alpha test at 0.05 p-value or power. If you reject the null hypothesis but is correct, type 1 error will apply by 5% error value. If you accept null hypothesis and is wrong, type 2 error false negative will be applied by B error for 30%. Thank you.